He came to me with a new tumor found in the good kidney, in the functioning kidney. And if we remove the good kidney, he basically will need dialysis after surgery.
Dr. Wong, do you like to eat kidney?
Not my usual diet.
So I heard that if you take kidney soup, or if you eat kidney in general, it will help with your kidney health and it maybe even prevent kidney cancer. What do you think?
This is definitely a myth, but let's take this opportunity to explore more about kidney cancer.
Hello, I'm Dr. Wong Siew Wei, Senior Consultant Medical Oncologist at Parkway Cancer Centre. My areas of interest are in cancers of the kidney, prostate, bladder, digestive tract and lungs.
So before we talk about, kidney cancer, maybe we talk a little bit more about the kidneys itself. So what exactly is the kidneys? Where does it go and what does it do?
Kidneys are two bean-shaped organs situated at the back of the abdomen. They are responsible for many functions, including regulations of blood pressure, red blood cells production, and calcium level. On top of that, they also remove excess water, salt, and waste products from our body.
Yeah, so the kidney has like so many different functions. I'm supposing each one of them does different things.
So the kidney has the outer part and the inner part. The outer part is called renal cortex and the inner part is called renal pelvis. The filtration is mainly done on the outer part and the water reabsorption from the middle part, and the central part is where the urine drains to the bladder. Cancer can arise mostly in the outer part but also in the inner part as well. The commonest cancer occurs on the outer part 85% of the time, and we call this renal cell carcinoma, in short RCC. Those that arise in the middle part is less common and they are more similar to cancer that arise in the bladder. Within this RCC, the commonest type is actually clear cell renal cell carcinoma.
I see. So with all these different kinds of kidney cancer, how prevalent would you say kidney cancer is, especially in Singapore?
If we talk mostly about RCC, kidney cancer is ranked number 7th in terms of cancer in Singaporean men, but it's not as common in Singaporean women.
So it affects men more so than women. I see. So when we talk about kidney cancer, right? When you say it's the 7th most diagnosed cancer in Singapore for men, around what stages do they get diagnosed?
So over the years, we have seen increase in incidence of kidney cancer detection. This is largely due to incidental pickup diagnosed when men go through other investigations for other health complaints. Because of incidental pickup, we tend to see a slightly higher proportion of cases coming in at stage 1. About half of the cases come in at stage 1. About a quarter comes in at stage 4. Obviously, the cure rate for stage 1 kidney cancer can be very high, up to 90% and above.
I see. So if they come in for stage 1, when they are detected at stage 1, it means that they weren't presenting any symptoms, they were coming in for other unrelated reasons, right?
These are completely what we call asymptomatic.
I see.
Issues.
Then at what stage would you start getting symptoms? What kind of symptoms would that be? Because kidneys, right, there are so many different functions. I'm sure there will be a lot of different kinds of symptoms.
So the kidneys can have big masses growing in them until quite large extent before patients become symptomatic. Now, we have seen patients coming in with up to 10 centimeter size lesion in their kidneys before they even notice blood in the urine or pain over their loins. When the cancer spread, occasionally they may experience weight loss or pain depending on where the spread has occurred.
So when you mentioned that more men than women are diagnosed with kidney cancer, is that a risk factor or is it just that more men are going for this kind of screening?
It is a risk factor. So apart from that, we also know that incidence is between the age of 50s to 70s. Smokers also have 30% higher risk of kidney cancers, and they tend to have more advanced cancer when the cancers are diagnosed. Then patients with chronic hypertension that's poorly controlled, chronic kidney disease, all of them have heightened risk factors.
How about other things like, being overweight? That tends to be a pretty common risk factor as well.
Yes, common risk factor for quite a few cancers, including kidney cancers. Then there are certain exposures, such as petrochemical industry workers. They are at slightly increased risk, especially petrochemical and cadmium-related heavy chemicals.
So how do we reduce this risk then? I mean, of course, managing our chronic conditions, making sure that we're not overweight and all that. Maybe lifestyle changes, exercise, like that?
There is no specific measure, but with any healthy lifestyle, it's always better in terms of cancer reduction. So healthy diet, exercise, and maintaining healthy body weight. Very small proportion of kidney cancer is due to underlying genetic disease.
So most of it is something that arises from environmental stressors?
Most of it is something that we can't explain fully.
So if we want to pick up kidney cancer, as you mentioned just now, if you pick up kidney cancer early, then the chances of cure rates are higher, right? So how do we pick up early? Is there any particular kind of screening?
Okay, screening refers to doing tests when someone do not have any symptoms. Now, unfortunately for kidney cancer, there is no strong guidelines to do any particular screening test for early detection. For that reason, for anyone who is at risk of kidney cancer due to certain risk factors, they should be vigilant for any new symptoms and discuss with their doctors early. For those who have imaging tests done for unrelated health complaints, if the report ever mentioned any lesions in the kidneys, they should pay attention to see whether any follow-up scans are required.
So usually these kind of imaging, they'll be going for what kind of conditions?
Usually patients will go to doctors with vague abdominal discomfort or potentially indigestion. Then they may do some ultrasound.
So let's say, right, I'm really vigilant about my symptoms and I realize that I'm having maybe some pain in the abdomen, I'm having some blood in the urine, and I go and see a doctor. What would you do?
Your GP routinely will confirm the presence of blood in the urine by doing a simple urine test, what we call urinalysis. Occasionally, the urine test may pick up cancer cells, but it is not very sensitive. Ultimately, to confirm kidney cancer, usually there will be some imaging involved. A non-invasive imaging will usually be an ultrasound that will pick up a mass, but to see the mass in detail usually will require further imaging such as CT scan or MRI. So the CT scan and MRI will tell us the extent of the tumor on top of confirming the presence of the tumor, the location, the number of tumor, and whether it has spread.
Would it be possible to have a tumor in the kidney that is not cancerous?
Yes, there are lesions in the kidney that may not be cancerous, and some of them may even grow quite large.
So you will have to go in and check like what's inside the tumor to see whether it is cancerous or non-cancerous?
No, if you use CT scan or MRI, usually there are some features on the scans that will guide us that certain lesions are not cancerous.
So after looking at some of these imaging, is that you're looking at it like, I'm very, very sure this is kidney cancer. Is that still a diagnosis, or do you have to go in to really take a look?
For kidney cancer, if it's operable, a lot of times surgeons will proceed straight to surgery, assuming patient is fit for surgery and there is enough kidney reserve after surgery. From the surgery, the specimen will be inspected for the type of kidney cancer and additional information will be obtained. In situations where the imaging information is not clear-cut, surgeons are not very sure it is cancer, patients may be advised to undergo a small needle biopsy before a more radical intervention.
Then when you said that, you can capture people at stage 1 or stage 4, what does this staging mean and how do you all see it?
We stage kidney cancer looking at the size of the tumor and the extent of the tumor growth into adjacent areas such as the renal vein, the adjacent lymph nodes, and the outer covering of the kidney. Obviously, cancer that has spread to distant sites such as the lungs are considered stage 4. So this information is obtained from examination of surgical specimen plus imaging results.
So just now you mentioned something about surgery to treat kidney cancer. What other forms of treatment options are there, and how do you even know? I mean, of course, as an oncologist, with so many different kinds of different patient profiles, how do you decide then what is the most appropriate treatment?
There are many factors that we have to consider before we decide on the correct treatment. First of all is the stage. But we also have to look at the number of tumors. As I mentioned earlier, there may be tumors in both kidneys or multiple tumors within one kidney. We also need to look at the location of the tumor itself, whether it's in the periphery of the kidney or central part of the kidney, the underlying kidney reserve, and the patient's fitness to undergo the treatment as well. So we talk about surgery as one option. Even within surgery, there are
Different kinds
different
of
types of
extents,
surgery.
right?
Okay. More and more surgeons will try to offer patients what we call partial nephrectomy, partial removal of the kidney instead of full nephrectomy. But only certain patients are suitable for partial nephrectomy, largely dependent on the location of the tumor.
And maybe the size too. You have to cut out big ones.
Size may not be the absolute contraindication. We have seen partial nephrectomy done for tumor as big as 7, 8, 9 centimeter. Mainly the location, because if it's located quite centrally, you cannot
Take out the middle.
take out the middle. You will have to sacrifice the whole kidney. So partial nephrectomy is increasingly favored, and I have a case about a year ago where a man has a non-functioning kidney on one side because of poorly managed kidney stone that happened overseas. So the kidney stone lodged in the ureter, and basically the kidney was under a lot of pressure and it stopped working.
He came to me with a new tumor found in the good kidney, in the functioning kidney.
And if we remove the good kidney, he basically will need dialysis after surgery. So we'll have to think of all options to help this man, and luckily he was suitable for partial nephrectomy. If he wasn't suitable, there are other options such as cryotherapy, meaning delivering a
Just freeze out the
ice ball to freeze the tumor, or radiofrequency ablation, where electricity is delivered to kill the cancer cells.
I see. So let's say there is a good kidney, and then that good kidney develops the tumor. Then if you do a partial nephrectomy, you still have sort of like half a good kidney left.
Yes.
I see. With all these tumors that are operable, of course, the surgeon can go in and remove the tumor. But what if, as you mentioned, right, some patients are inoperable, either the tumor itself is not operable, or maybe the patient is not fit for surgery? Then what are the options?
So for small tumors in the kidneys, if the patient is not fit because of elderly, we have a few options. One is to watch them, especially very small lesions, lesions that are less than 4 centimeters in size. But for other patients who are interested in intervention, I've mentioned cryotherapy and radiofrequency ablation as an option to consider with reasonable efficacy. Now, for cancer that has spread, that's stage 4 cancer, typically we do not operate on the kidney as a first intervention. We would usually consider drug treatment, what we call systemic therapy. And the two main classes of drug treatment for kidney cancer, or clear cell kidney cancer especially, are targeted therapies and immunotherapy.
So chemotherapy, is that considered chemotherapy, or chemotherapy is like a completely different thing?
Chemotherapy is not typically used for the treatment of renal cell carcinoma because they tend not to produce any response, except in rare situations where we are treating uncommon non-clear cell kidney cancer, such as medullary kidney cancer.
Just now you mentioned targeted therapy. That sounds really interesting. I've not heard of that before. So what does that mean, targeted?
So for kidney cancers, targeted therapies are usually in a pill form, and they are designed to slow down the growth and spread of kidney cancer via reduction in protein cross-talking and interfering with growth of new blood supply to the cancer cells.
So what kind of targets would those be?
Those are targets where the cells communicate with each other to have this abnormal growth. So it's abnormal growth protein, and in medical terms we call it tyrosine kinase.
I see. Then when you tweak this kind of, because I'm sure with this kind of tyrosine kinase, maybe normal cells also use the same pathway. Does that cause a lot of side effects for people?
The main side effects that we see from this is from the disruption of new blood vessels formation. As normal body also have blood vessels, big blood vessels and small blood vessels, we do see this kind of side effect as a class side effects. So typically high blood pressure is seen in up to 20-30% of our patients, and rarely we see other side effects such as blood clots or heart attack, but those are typically less than 2-3%.
I see. That actually can sound quite concerning. Are there ways to prevent this kind of side effects from happening?
So the commoner side effects such as rash, mouth ulcers, diarrhea, typically we are proactive in addressing this and will provide patients with some support kit at the start of treatment. In terms of blood pressure monitoring, we'll also be addressing that actively and advise patients to get blood pressure monitor at home and start blood pressure lowering medication early.
So targeted therapy actually sounds really good, because whenever people hear cancer, they usually hear chemotherapy. And if kidney cancer is not responsive to chemotherapy, that means targeted therapy is really kind of making a big difference for these patients who do not have chemotherapy options.
So we mentioned targeted therapy and immunotherapy. Both are very important in maximizing patient outcome, especially in advanced disease. So renal cell carcinoma is very diverse because of so many different subtypes. Even within the same subtype, there are different behavior, different biology, and we have understood a lot more about them in recent years. On top of that, we have a lot of new drugs. So how do we combine these new drugs for each individual patient? It needs to be personalized.
So we actually covered a lot of bases today. Thanks so much for telling us all about kidney cancer, just coming from the myth that eating kidney doesn't help to protect your kidneys. So yeah, maybe we just end off with some key messages you want to tell us all about kidney cancer. What are some key things that you wanted to ask now?
Kidney cancer is highly treatable. For early stage kidney cancer that's found either incidentally or because of early detection,
early surgery or non-invasive treatment may provide very high chance of cure. In cases where patients have stage 2 or stage 3 kidney cancer, they have higher risk of relapse after surgery and can be considered for immunotherapy as additional treatment after surgery to reduce their relapse risk. For stage 4 kidney cancer, we have various new drugs typically used in combinations in appropriate patients, which can accord patients very good response rate and very long cancer control. Some of these patients continue to work, continue to have quality times with their family, and may live well in excess of 2 to 3 years. The last message is because of the location of the common kidney cancer, which is the outer part of the kidney, typically we don't see symptoms. So the blood will not trickle into the ureter until the lesions grow quite centrally. So bleeding is a sign that you should not ignore. If you see it, you probably should see doctor early instead of waiting for another 6 months. If you have unusual discomfort in your loin, definitely speak to your doctors, especially if you're above 40 years of age.
Yeah, so don't wait. By the way, the soup is cold. Have you tried it yet? I think it's not bad. It's quite...
Definitely worth trying.